Our ABC57 Investigates is bringing you a new series called The Cost of COVID-19. Tonight, part 2 focuses on frontline healthcare workers and the emotional, physical, and mental toll brought on by the coronavirus pandemic and the daunting data that shows healthcare workers losing their lives in the line of duty, trying to save others. ABC57's investigative reporter Brenda Coopson is digging deeper into this tonight.
Coronavirus cases show no sign of slowing down, and as flu season picks up, American lives are largely in the hands of our frontline healthcare workers. Workers who stand in the face of death daily, risking their own lives to save our families and friends, and hoping they're not bringing it home to their own families.
He was deteriorating quickly. And you really just basically, watched him die. And that was the first time that we really had to experience that.
Michaela Balfe works as a primary caregiver at Spectrum Lakeland. She's in charge of checking vitals, giving patients medication, watching out for any changes in a patient's status, and answering difficult questions.
How do we help him through that?
Is just one of the questions frontline healthcare workers like her try and answer every day.
You're just constantly trying to emotionally support people who are really sick a lot, to sort of manage emotionally throughout the day and try not to take home with you.
Balfe tells me it's about finding a support system at home and with your coworkers.
Taking that physical break and just really relying on the team members has been a huge thing for us.
Carly Wiesel is a charge nurse, or that point person.
And helping to make sure that the staff isn't overwhelmed with the amount of patients that they have in their section, and then also kind of being a runner if they need medications brought to the room right away, if they need supplies brought into the room, just trying to limit the amount of staff that's being exposed to the COVID patient.
And when it comes to the pandemic,
there has been an additional workload.
So we all obviously wear our masks the whole length of our shift, and then we have our N95s as well that we wear when we're taking care of any COVID suspected or COVID positive patients.
PE is just so critical in maintaining my safety and my patient's safety, and then the community's safety.
But Balfe tells me the necessary safety precautions
complicates direct patient care by creating a barrier.
Balfe is in charge of a lot of invasive nursing procedures, like hooking up an IV. Procedures that have gotten tougher because of the extra equipment she's wearing.
So there's this added element of stress that you're working, with all of this gear on, and you want to make sure that you're able to still take care of your patient properly.
And even if there is an emergency,
I still have to stop and put on my mask, put on my face mask, put on my gown, put on my gloves, make sure everything is, make sure I'm protected before I go in there, despite the urgency, perhaps of whatever the situation may be.
And with PPE being such an essential part of keeping both staff and patients safe, Balfe tells me things were initially very stressful. But as time has gone on and donations have poured in, they've found a consistency
that help us be more confident that we have the PPE that we need, that we're protected in a way that's actually protecting us and our patients and our families at home, the community, the outer community.
But others haven't been so lucky.
We have overall 87% of nurses that work in hospitals reporting that they are being pressured to reuse equipment.
Jean Ross is a registered nurse with National Nurses United, the largest organization of RNs in the country. The group recently released a study with data collected from nurses across the country.
That's where we're getting our statistics, and that's why we say it's probably even higher.
At the beginning of the COVID-19 pandemic, local nurses believe work was a lot more stressful.
The data was changing by the hour. What we were being told to do was changing by the hour. There was a lot of uncertainty and stress on the staff, and wanting to make sure that we were protecting ourselves and that we were going home safe to our families and not bringing the virus home to the family as well. And so it was very chaotic.
The National Nurses United study found that 43% of nurses worry that they'll bring the virus home to their own families. Now, Wiesel tells me the communication is much better and they're more prepared for what to expect. But the work is still tough.
Definitely physically, it's been a challenge.
13 hours, nurses are on their feet working in tense situations with someone's life on the line and sometimes their own.
We've had 1,866 healthcare workers die. 245 of them are registered nurses. And we figure well over 355,000 healthcare workers have contracted the disease.
These factors all taking a toll.
Emotionally, it's been stressful.
And time doesn't necessarily make it any easier. But Balf and Wiesel agree it's about having a healthy coping method.
Being able to rely on each other for those tough times.
When you look at the big picture, the number of nurses feeling new pains is growing.
We've got 42% of nurses who report feeling stressed more often than they did before the pandemic, and 29% are just sad and depressed much more often.
You really feel for your fellow healthcare workers who are experiencing less support in the community, less support in their workplace, trying to deal with this stuff.
If we were assured that the employers would take rules, regulations, laws seriously, that would go a long way toward making us feel better as workers and also keeping us safe. The only way we can keep the public safe is to keep us safe too. You don't want to know what happens when you don't have enough healthcare workers inside.
And for anyone out there who has a loved one fighting for their lives, your frontline healthcare workers want you to know you're not alone.
We hear them, we understand that they are stressed, and we understand that they're anxious, and just know that we are trying our very best to keep them in the loop and keep them updated. We have the restrictions in place, one, to protect their loved one, to protect themselves, and also to protect ourselves, our team, and our family members as well. Just be patient with us, and we'll work all together.
Now, frontline workers know that this is the type of work they do, and they're no strangers to illness and death in the workplace. But Ross tells me it's the sheer amount of it they face daily that makes it all so daunting. Here at ABC57, we're trying to help solve the tough problems impacting your life. So if you have a story you want us to investigate or look into, please send me an email at 57investigates@abc57.com or fill out the form on our website to submit a tip. In studio, I'm Brenna Coopson, ABC57 News.